Hi, my name is Jade Gupton, and I'm doing the oral motor problems in a stroke victim. This is for the anatomy and physiology course for the group project. The effects of a stroke will depend on which part of the brain is actually injured and how severely it is injured. Strokes may cause sudden weaknesses, loss of sensation, or difficulty with speaking, seeing, or walking. Since different parts of the brain control different areas and functions, it is usually the area immediately surrounding the stroke that is affected. Some people with stroke may actually just think that it's actually just a headache or something, and then some people may not even notice it, and it can be completely painless. After a stroke, some people experience language deficiency, aphasia, which is also known as aphasia, and that is what I'll be talking about, is the ability to communicate after a stroke. These deficiencies will also, be dependent on the extent and the location of the damage after the stroke. Deficiency in the social communication skills, which is also known as pragmatics, may result in the following things I'm going to discuss. The first thing would be difficulty sequencing thoughts, so they wouldn't be able to get all their thoughts together whenever they're telling someone a story about something. They can't switch topics without a warning, or they may just go off on tangents without informing the listener. So they may just talk out of their head randomly rather than just carrying on a normal conversation. They have a difficulty with taking turns in conversation. For example, if I'm speaking to them, they may just start completely speaking to someone else and not even pay attention to me. Also, they have trouble using appropriate tone of voice and interpreting certain subtleties of conversation, such as sarcasm or humor. They may have trouble understanding that or doing that. They also have problems keeping up with a fast-paced interaction. So if I'm talking to them extremely fast, they may catch very, very few of those words that I've communicated with them. Also, sometimes they may either be over-emotional or not even emotional at all whenever they are talking. They have little to no self-awareness of inappropriate actions or responses. The oral motor functioning is also something that is affected by a stroke. The problems of this may be the muscles in the lips and tongue will become weaker, which is dysarthria, or they could become less coordinated, which is apraxia. This will make the speech not be very clear at all. Also, the breathing muscles may be weaker, affecting the patient's ability to speak loudly enough to be heard in a conversation. The muscles may also become so weak that the person is unable to speak. This means that they may need certain augmentative or alternative communication aids to help them express ideas, such as communication boards. They would have to write something up there, post something up there to communicate with other people. The weak muscles may also limit the ability to chew and swallow effectively, which is also known as dysphagia. Also, a stroke victim may have cognitive problems as well after a stroke. Cognition simply means your thinking skills, the ability to think about things. So therefore, the cognitive difficulties that are common in people who have had a stroke on the right side of the brain. And it will vary in the seriousness depending on the location and severity of the damage that's been done. Certain problems that will occur with someone with the cognition portion is they won't be able to be aware of their surroundings. They have poor attention skills and can't really stay on task very well. They have difficulties remembering things, or their memory will fade. Also, they have poor reasoning skills and problem-solving skills. The executive functioning skills will also be very limited, and this will include such things as goal setting or planning to do things, and the flexibility of their thinking as well. Also, these individuals will have trouble concentrating when they are in internal and external distractions, such as carrying on a conversation whenever there's a lot of other people in the cafeteria. They're not going to be able to concentrate on what you're saying because of the noise that surrounds them. Therefore, you're going to have them, just you and them communicating, and nothing else around that will distract them. Also, they will process information a lot slower than normal, and the recent memory that they have will also make it difficult for learning, will also make new learning difficult. For example, some people may have trouble learning new things that are being taught to them, such as like how to get in and out of a wheelchair safely. These are just a couple things that can be affected by a stroke in the oral motor portion. And thank you very much.